welcome back to the last segment of Monday's edition of Morning Ride. And today we'll be talking about a health condition that affects millions of people across the world, peptic ulcer disease. Now, this disease is often misunderstood. Sometimes it is mismanaged, and in many cases, it is self-treated without proper medical guidance. Now, to help us understand this topic today, I have in the studio two seasoned professionals right here with me in the studio. First, I have pharmacist Gregsonil Idubofu. Good morning, sir, and thank you so much for joining me.
Good morning. It's wonderful to be here again.
I also have the beautiful lady, pharmacist Francisca Wijike. Good morning, pharmacist. Thank you for coming.
It's always a pleasure to be here.
All right, both pharmacists here will be teaching us or educating us on understanding peptic ulcer, the causes, the symptoms, and prevention. So I'll start with you, pharmacist Gregsonil. What exactly is peptic ulcer, and how does it develop in the body? What causes it? Spicy foods to be blamed, because most persons say, oh, when you eat spicy food, you get ulcer. Or is it stress? Just make us understand what peptic ulcer is, how it develops in the body, and what causes it.
Thank you very much. You've actually even started answering the question yourself. So
okay. I'm not
just asked to what you have said.
Many assumptions.
Yes. You are not out of
so
line.
People say stress. So I want to know. We really need to know.
That's what I'm saying. You are not out of line. So I'm happy that you also know some things about peptic ulcer disease. So peptic ulcer disease, PUD, which what we commonly call ulcer, is a disease that results from excessive secretion of hydrochloric acid.
Okay.
Yes, in the GI, that's the stomach, which can now lead to irritation of the mucosal lining. Now, to have a better understanding, the mucosal lining is actually what protects your stomach from acid secretion, from acid. You have acid. Acid is what actually digests your food when you eat them.
Okay.
So when you eat food, there's acid secretion, all the digestion process and the rest of them. But there's a mucosal lining to protect your stomach. Now, when there's an excessive secretion of that hydrochloric acid due to several factors, what happens is that the mucosal lining is destroyed.
Okay.
Then the acid pours out into the stomach. That is when you begin to experience those symptoms, those burning sensation, and the rest of them, and the pain especially. Then, like you said, I believe as the discussion goes on, we're going to also touch on the causes.
No, I want you to tell us the causes of peptic ulcer, so we'll understand what it is.
For the causes, there are several causes, there are several factors that can lead to peptic ulcer disease. Okay. Like you said, stress could be one. Stress is one of them. Spicy food is another one. Caffeinated products, excessive intake of caffeinated products is another one. Okay. Then the prolonged use of the medications we call NSAIDs, non-steroidal anti-inflammatory drugs. All these ibuprofens that you take for body pain, diclofenac, and the rest of it. So prolonged exposure, prolonged use of this medication can also lead to peptic ulcer disease. Then, of course, the major culprit is Helicobacter pylori. It's a bacteria.
What?
A bacteria.
Okay.
So that causes peptic ulcer disease. We call it Helicobacter pylori. Okay. That's why sometimes when you complain of this pain, stomach pain, you tell them it radiates to the back, to the chest, and they'll ask you to go and do. There's one test they will ask you to do first. They will ask you to do H. pylori test. Okay. Then they cannot do endoscopy to confirm if it is truly ulcer that you have or not. Okay. Because it has sinister symptoms. No other sinister symptoms that mimic other. So they want to be sure that this thing is actually peptic ulcer disease.
Okay, Pharmacist Francisca, do we have different types of peptic ulcers? If we do, can you distinguish one from another?
Okay, yes, we actually have two types of peptic ulcer. The first one is the duodenal ulcer. That one is the most common one. So for 90% of the time when you hear somebody say, I have ulcer, that is the type that they are talking about. Okay. The other form of peptic ulcer is a gastric ulcer. Okay. That one is more common in the older people, and it is very rare. It accounts for 20% or less of the ulcer cases that we encounter. So, of course, the symptoms, that's not what you asked me.
No, I said to distinguish. So
yes,
distinguish between the symptoms and...
Okay, duodenal ulcer, what distinguishes them mainly is the location at which it happens. They all happen within the abdominal region. But the duodenal ulcer, from the name duodenum, duodenum is a part of the small intestine.
Okay.
Yes, so that is the region at which it happens. But the gastric ulcer happens around the stomach area.
Okay.
So for duodenal ulcer, the people with that kind of ulcer, they start to feel pain after eating. They start to feel pain after, I don't know if I'm mixing it up, 15 minutes to 30 minutes after eating. They start to feel pain around, usually it's around the lower breast, the breastbone region, and sometimes it radiates to the back.
To the back.
Yes, they feel pain around that region. While for the gastric ulcer, the pain happens between 2 to 4 hours after eating. Yes, it's usually the lower region of the abdomen. And like I said, it is, even if it happens in older people.
Okay.
So that is.
Now, Pharmacist Gregson, when I asked him the causes of ulcer, he did mention some causes that most people have, or most people think that is, the reason why they have ulcers. Poor eating patterns and skipping meals, can it lead to ulcer? Because just yesterday, my mother even told me, she said, you are skipping meals, you are not eating, it could cause ulcer. So I want to know, poor eating habits and skipping meals, can it really lead to ulcer?
Okay, skipping meals, usually, as it applies to every other thing of our life, once you develop a pattern, it's likely that, especially with regards to your body is already used to that pattern. So if you try to deviate, even when you want to change a pattern, it's not usually easy.
Okay.
So if you have a pattern of eating, like normally before now, you eat morning, afternoon, and night, your body around that time, it produces acid.
Oh.
To count, yes, like it releases those acids to help
break down
digest.
those
Yes, it's already used to that pattern.
Okay.
So by the time you don't eat around that time, of course the acid is there, and it will now start to. If you have an injury, okay, not really, no, it just worsens an already established injury there. I can't say
it can't really cause ulcer, but if you had ulcer,
like,
it makes it worse.
Yes, like he said, the top causes of ulcer are H. pylori, the bacteria,
Okay.
and then excessive use of NSAIDs.
Okay. All right. Pharmacist Gregson, let me come back to you. Some certain habits or lifestyle, can it make someone more vulnerable to ulcer? Habits like smoking or alcohol consumption.
Definitely, definitely. For chemistry students, alcohol, there's a process it goes through.
Okay.
It's converted to, it begins to irritate the stomach line, to act like the acid too. So that's why for people that already have ulcer or that are at risk of having ulcer, we always advise them to discontinue alcohol, cut down or discontinue smoking.
Okay.
For most of the smokes, cigarettes and rest, they contain nicotine. So all those ones they also increase irritation, if not even to instigate it. And again, another lifestyle that people would also watch out for that can lead to peptic ulcer disease is late night food. Those that eat late at night.
It can cause ulcer.
Yes, I'm coming to that. Yeah, so it can worsen the ulcer. And then before I even go further, I want to just clarify one small thing. Between the duodenal and the gastric ulcer, and why one is 2 hours to 4 hours before you start feeling the pain. The pain usually come after a meal.
Okay.
So for those that have ulcer, when they eat, for one type of the peptic ulcer disease, 15 to 30 minutes, they begin to feel that pain. Mind you, there's already an injury. So when you take in food, of course, your digestive enzymes, the acids, they are released to digest the food now.
Okay.
Then when they are released and there's an injury, they also touch the injury. So they are not selective. Anywhere they see an opening, it looks like food, they act on it. That's why you feel those pain. Then for late night eaters, I've mentioned that before. Then those that take alcohol, then those that take then people that have very stressful lifestyle. You work all through the day, you don't have time to rest. That could also be another thing that you should watch out for too.
Okay. All right, Pharmacist Francisca, what are some signs or symptoms that people should watch out for? Early signs or symptoms that people should watch out for, that could indicate that they may be having ulcer, or about to have ulcer.
I think we already discussed the basic signs and symptoms of ulcer.
But just let us know again.
The stomach pain.
Okay.
Stomach pain after eating, or if you've not eaten, that's one of the signs. And then you feel nausea and vomiting, like feeling like vomiting, and actually vomiting, and then Those are the common signs.
But don't you think they're similar to normal stomach discomfort? Like normally, if you've not eaten, you have stomach discomfort. Sometimes if you even overeat, you eat too much, you may have stomach discomfort.
Yes.
So what differentiates ulcer symptoms with ordinary stomach
Just
discomfort?
take note of that pain
Just
after
the
a
pain.
meal.
After a meal.
Epigastric pain
Okay.
after a meal. When you eat food, within some minutes you start feeling pain. That is the gastric. But after some 2 to 4 hours,
Okay.
it will done it. The other thing you watch out for again, another symptom you watch out for ulcer is this. There is this burning sensation you feel along your lower esophagus.
Okay.
What people call chest pain and the rest of them.
Alright.
So I want to quickly add, for some time, when you feel chest pain, chest tightening, it could also be a symptom of ulcer. Yes.
Okay.
So not all those chest tightening is actually heart-related stuff also, but some of them could just be an effect of the excessive acid secretion. Then again, let's be mindful too, because there's something people should watch out for. If you have ulcer, or rather if you have asthma to start with first, you should be very, very careful not to develop ulcer. Yes, because you have the two of them, if they are comorbid, you have the two of them together, it's a very complicated situation.
Okay, Pharmacist Francisca, what complications can arise from leaving ulcer untreated?
Okay.
Because like I said, some persons may just say there's normal stomach discomfort and may not take it serious, but what complications can arise if you leave it untreated?
So, like we said, ulcer is like an injury in the stomach, and acids are getting into the ulcer and boring hole, like perforating it. So, from there, of course, imagine having a hole born into your skin, no outer skin, or you know how painful that can be. Now imagine inside your body and how delicate that area is. So it could result to needing to have a surgical procedure. Yes, that is one serious complication of ulcer. And then the discomfort generally, you don't live properly like you used to do. Pain from time to time, having chest burn and all of those things.
Okay.
Yes.
Can it lead to death?
Death, of course.
It can, when it develops into gastric cancer. So
Ulcer can lead to cancer?
Yes, there's what we call gastric cancer. So this is it. You have the acid is secreted, you don't treat it. Of course, it will continue to grow now, it's going to expand. It's going to bore. When you open, like those of us that use mosquito nets, if you bore a small hole and you don't quickly take care of that, you have children around, what would they do? They are fascinated by the holes, they will keep expanding it for you. So that's the same thing that applies. That same thing applies to ulcer now. So if it's left untreated, that injury begins to expand, because the acid is acting on them, the edges expanding them, and until that's what we call it a GI perforation. There are holes in your GIT. Then of course there's also intestinal perforation. It's a big challenge actually. Something that requires surgical procedures. Then the cancer, the gastric cancer. All this could actually, if left handed, it can lead to.
It could also lead to anemia because you're losing blood, like as it's perforating your stomach or the intestine. Of course, you're shedding off blood, so you can become anemic from.
That is
ulcer.
quite some serious complications. Okay, so how can ulcer be diagnosed? Is there any test or procedures that one can go through to confirm that they have ulcer, or can I self-diagnose myself? Can I just, once I feel the pain, you've told me the symptoms, can I just go to the pharmacy and say, oh, I feel this pain, I suspect it's ulcer?
There is small room for self-diagnosis, but you must confirm it from a medical practitioner.
So what test and procedure should I go through?
There's what we call H. pylori test.
H. pylori test.
Yes. They also do endoscopy.
What is endoscopy?
It's a test where you get to the lab, they will give you. There's this. Let me even use this breath test to even start with. There's a breath test people do.
Breath.
Yes.
Okay.
So you do that one too. So then endoscopy. When they say endoscopy, anything scopy means there has to be an invasive. Something has to be a probe to probe. You understand? To check all those ones. So that is it. So they do that one to confirm if the H. pylori is actually what the cause of the ulcer. Then after those are the two basic tests. Then when I said the self-diagnosis, which anybody can do, but you must confirm, is I know these are the symptoms of, like people are listening to us now. These are the symptoms of ulcer. You feel burning sensation, you feel like throwing up, nausea, vomiting, you feel pains that radiate to your back. After eating 15 to 30 minutes, you are feeling this sharp epigastric pain. Understand? And of course, sometimes chest tightening, then breathlessness sometimes. So when you get all these ones, It is not to say that only ulcer has these symptoms. That's why I say ulcer has sinister symptoms.
And that's why you need to confirm.
To
be
confirm,
sure.
exactly. So the confirmation now is not going to be from a medical practitioner who may, over 90% of the time, they will recommend that you do either of those tests or the 12 or the tests.
All right, Pharmacist Francisca, what are the current medical approaches to treating ulcers or peptic ulcer?
Okay, I remembered something, but I feel like I'll be deviating.
No, go ahead.
So we've been talking about H. pylori. H. pylori, most of us don't know how it is contracted or how it gets into the body.
Okay.
So
H. pylori is the ulcer, right?
No, that's the bacteria.
That's the bacteria that causes ulcer.
ulcer.
So how does it get into the body?
Okay, so like most other bacteria, the way they get into the body is through the hands, of course, your hands, your powerful hands. So yes, from an infected toilet or from somebody's bodily fluids, it can be transferred through bodily fluids, like the vomit, like from the saliva. The bacteria can stay in the saliva. So if you, for those people who give their children to somebody and they start kissing their mouths or something, they can just transfer the bacteria to the mouth of the child or to the mouth of an adult, as the case may be.
So it can be transmitted through kissing as well?
Yes, through kissing. It can be transmitted through kissing.
Okay.
Yes, that was what.
And then it gets into the body of that person.
Yes,
and causes ulcer.
Yes, it goes straight to your stomach and deposits there. It secretes. It converts urea in the body. Urea actually helps in protecting the. It's an acid. Is it? No. It converts urea to ammonia.
Okay.
That ammonia protects the bacteria from being killed by the acid in your stomach. So that is the way it launches itself into your stomach and stays there.
So you're saying that apart from skipping your meals, poor eating diet, and the stress and spicy foods, I can get ulcer by not washing my hands, kissing someone and getting the H. pylori into my system.
Those are the not eating and lifestyle and all of those things are just contributory. The main are the
H. pylori
and H. pylori. Yes, those are the two main causes.
So poor hygiene, you can get H. pylori through poor hygiene, not washing your hands well, kissing the wrong person, taking food. Okay, so let's talk about the treatment now. What's the treatment for peptic ulcer and other kinds of ulcer?
Okay, the treatment for peptic ulcer. So when you've done your lab culture and sensitivity test, and they discover that there's H. pylori, of course we have to get rid of the bacteria H. pylori using antibiotics, as recommended by your health practitioner, pharmacist, or your doctor. Yes, and then that is a core treatment. And then there are other medicines too. Okay, there's a triple action therapy for using the proton pump inhibitor, using antibiotics and an antacid. I'm sure we are sure of. I don't want to mention specifics, so we don't go and start abusing any of these.
You can just mention one common brand like what's it called? Everybody know omeprazole. Then which other one again? The
cimetidine.
That's H2 antagonist. Then which other one? The antacid, the common one.
Gestid.
That's it. So these are
okay. For Mrs. Grassone, can ulcers heal completely if I take antibiotics and all the medications my medical doctor or pharmacist will give to me? Can it heal completely, or do they tend to reoccur?
Yes and no. Yes, in the fact that if you go through the proper course of treatment, you can actually eliminate the H. pylori and, of course, put the acid under check. Okay. Then no, in the sense that it is already a wound. If you go through the same things that caused it for instigated in the first place, they can also trigger it. That's why I tell people that when we ask people when they come to the pharmacy to buy me, we ask them, do you have any history of ulcer? They say, I had it before 10 years ago, but I've not experienced it for the past 10 years. Say, okay, but you've had ulcer. At any point, say yes, so you can't take NSAID. You understand? Because there's this habit of people abusing what they feel they have taken care of, like they've handled the ulcer caused by NSAID, they no longer feel so they can take NSAID as much as they want now. Same goes for people that take spicy food, where you tell them, you had ulcer, ulcer don't go. So they can take, they say we should take pepper soup and then whatever can do. So there's tendency.
Should I avoid pepper soup if I have ulcer?
No, well, spicy food you should. I won't tell you to totally avoid, but if you ask me, if I want to be sincere with you, I'll tell you avoid it. Totally. But I know it is very difficult for the natural man to avoid some things.
Where I come from, you can't avoid pepper soup.
You are from where?
from the
Central.
Niger Delta region. I don't want to mention it now, but we can't do without Ukudu. We can't.
Okay, you are from my
but
side.
I should
It's
reduce
okay.
it. If someone has ulcer, the person has
Cut
to
down,
reduce
exactly.
it.
Cut down. Also,
Okay.
watch it when you take such things. Be prepared.
Okay.
Know that I've taken this thing spicy.
So be
There's
prepared. Get your
likely that I may
digestive
have
close
this.
to you.
understand?
All right, Pharmacist Francisca, what are some mistakes that people make while managing ulcer? Some mistakes that we shouldn't be making at all while we're managing ulcer?
Okay, and before I get down to your question, I feel the need to mention some examples. We've been saying NSAIDs. An example of an NSAID is aspirin, then ibuprofen and diclofenac. People who abuse all these
Yes,
medicines.
ibuprofen
when
and
they're
diclofenac.
having-
Body pain medicine.
Yes, body pain medicine.
So they should not abuse it.
Yes, those are. And then the mistakes people make, self-medicating.
Yes.
Self-medication is very, very bad. So people, when they start feeling the symptoms, they might just rush into a pharmacy and say, give me Amoxil or give me one of the antibiotics, and they just take it and take it for 3 days or take it for 2 days, because I know it's very hard.
Some even come to the pharmacy and they will still ask you to give them that ibuprofen that they have stomach pain. You understand?
Very
It is
wrong.
pain now. It is pain.
Okay.
They will come for ibuprofen to manage the pain. Meanwhile, the ibuprofen is a culprit in that pain. So,
Okay, so for someone who is currently managing ulcer,
yes.
what lifestyles are non-negotiable? Like you already mentioned one, spicy food,
Leave alcohol.
non-negotiable.
Alcohol should be totally out of your mind. Smoking.
When you say alcohol, what about
Alcohol.
red wine?
Red, if it contains alcohol, fine. It's still
Alcohol,
yes.
to reduce it.
So then, what's it called? Smoking. Person should cease smoking. Then smoking of all kinds. Then let me not say that any type of smoking that will cease smoking. Then of course, caffeinated products.
When you say caffeinated, you mean
Any
coffee?
coffee, anything containing caffeine, all those ones. There are some, but there's this in popular common medicine they buy. They say it's for hangover or whatever they call it. That one also contains caffeine. Some of these painkillers, that paracetamol and this one.
You should not take paracetamol as well?
No, I'm not saying paracetamol. I say some of them they combine with paracetamol. They call
Okay.
it extra, something extra.
Panadol
They also
extra.
they can say you avoid them. Then again, I've mentioned alcohol, mentioned smoking, then caffeinated products, and of course, spicy food. I mentioned that earlier. Then stress.
We should avoid stress.
Let's avoid stress. And the most important one of all is try to eat a healthy diet and eat early enough. Give
Alright.
enough time for the food to digest before you go to it. Because, okay, let me just clarify. There's one of the ulcers that occurs mostly at night. We call it nocturnal. You feel the pains in the night. Nocturnal pains, which is duodenal ulcer. You feel the pains in the night. Nocturnal. So sometimes
Why?
you see, that's just how it is programmed. You know, because that one is at the lower extremes.
Oh.
Of course, when you've eaten your evening food,
And
it
you're
will
going
take
to
some
bed
time for the food to move,
get down.
digest, and before it gets to where it will now trigger the pains. So that's why somebody tell me in the morning that all through the night I could not sleep. I felt pains all through the night. I know that the person is suffering from duodenal ulcer.
Okay, Pharmacist Francis, I wish we had so much time to talk about this. It seems like it's a very elaborate topic that we need enough time to talk about, but time is not on our side today. So what is your final message to someone who's watching now on how to maintain a good digestive health system and preventing ulcer? How to prevent ulcer? What will be your last message today?
Okay, we've literally said everything. So just summarily, just try to maintain a good lifestyle, manage your stress properly, and if you can, cut down on the stress, your stress level. Try to eat healthy vegetables, fruits, and stay off acidic stuff. Don't take too much acidic stuff like oranges. Oranges are acidic too. Yes, and try to eat early enough before going to bed. Like,
Aside from orange, what other fruit should they avoid?
Pineapple.
Pineapple,
yes,
they should avoid pineapple as well.
Not avoid. You
Just
can't avoid them. Now. They are
Cut
good
down.
to cut down.
Don't take too much
Be
of it.
mindful, yes,
Okay.
be mindful. Especially early in the mornings too. Early in the mornings and late at night.
All right.
It's a sensitive time.
Thank you so much, Pharmacist Francisca Wijike. Pharmacist Gressoni, your last word to our viewer on how to manage a good or how to maintain a good digestive health and how to prevent ulcer.
Fine. My colleague have said a lot about how to prevent ulcer. So I just want to quickly say something, summarize on the treatment regimen. So, and why it is important for you to consult with your medical professional, your pharmacist, your doctor, before you initiate any therapy. And when eventually they recommend medications for you, try to see through the entire course. I've had cases where people come to the pharmacy, they want to buy something for ulcer, and you give them this. What actually works best now is triple therapy, containing a proton pump inhibitor, another antibiotic, bambuzil or metronidazole, and then what's it called? No, there are three. the proton pump inhibitor and 2 antibiotics.
Okay.
Could be clarithromycin and any other antibiotics. So, but these things are prices. When you tell them buy this, they will tell you, oh, this thing is expensive. Some of them could be as much as 20 something, 25,000.
Okay.
The popular one, I don't want to mention the name, not doing that, is about 30 something thousand naira. There's one of like 60 something thousand naira. Then there are cheaper ones.
Because it's so expensive, they don't want to buy.
So they don't want to. So sometimes what we do is to now split them. We'll now bring this one from on its own, bring this one, bring this one. But even at that, they still complain. And usually, when you start the triple therapy, it's meant to be taken for 21 days. So my advice is that if your ulcer leads you to a pharmacy or to the hospital and the doctor recommends this triple therapy, please try. I know it's not easy, but try and see through it. Make sure you take it for the entire 21 days duration.
Okay.
Then before you can switch to monotherapy.
All right. Thank you so much, Pharmacist Gregson Idibofo. This has been an enlightening discussion. Really, I learned a lot on today's topic. Thank you so much for coming. I've been speaking with Pharmacist Gregson Idibofo and Pharmacist Francisca Wejike. Thank you so much for coming to help us with your professional insight on how to understand peptic ulcer disease, its causes, symptoms, and preventive measures. Thank you once again for coming.
Thank you.
Thank you so much, Pharmacist Gregson. All right, remember that ulcers are preventable and they are treatable. So please do not self-medicate. If you have any issues at all with your digestive health, please reach out to your doctor or reach out to your pharmacist. And that is how we wrap up Monday's edition of Morning Ride. Don't forget, like the pharmacists have advised, maintain a healthy lifestyle. Do away with alcohol and smoking if you can, if you are an ulcer patient, but always go to speak to your doctor, your pharmacist, if you have any issues at all. Once again, on behalf of the production crew,